it's Jennifer Shepard, your Integrative Manual Physical Therapist, and I love functional medicine. I have one of my best friends and colleagues from forever ago does not. And I respect her story, I respect her experience, and it really is a dance and understanding and balance of conventional medicine, which is primarily pharmaceutically based or surgically based or injections. Really, those are the tools that most doctors have. What medication can I prescribe for you? If you have pain, there's a medication. If there's a disease, there's a medication that supports it. Whereas functional medicine, we look deeper, we look bigger into the whole person. We look at the many millions of cellular processes that happen in our body every millisecond, every day, that keep all of our systems working and functioning to keep us healthy, or not when we are struggling. So her experience, which I can't speak solely for, and there are times when I see this actually quite common. Even the most well-intentioned functional medicine practitioners and functional medicine doctors get so focused on labs, which labs are very important at certain times. There's times where they can be overwhelming. There's a right time and a right place for them. And I do believe everybody should get regular labs on a regular basis to just see how your internal systems are functioning and how well they are doing. Unfortunately, often what happens is many functional medicine providers, they jump right into, well, let's supplement. So here's a lab that is deficient, therefore let's supplement. Which really, that starts taking us into conventional medicine. Here's a symptom, here's a drug, right? Here's a lab, here's a supplement. And I also support supplementation. I also am always concerned about the concept of supplement burnout, and are we supplementing the right thing at the right time, and are we looking at the entirety of the whole person? And when functional med is done really well, it really is diving into problem solving, into who are the other systems, what's the most important area that needs to be addressed first. And for most people, the most important thing is inflammation in our foods. Even when we think we are the healthiest of eaters, I have patients all the time, I eat healthy, but I drink a soda every day. Well, that's not healthy, right? I eat healthy, but I'm consuming a lot of grains. Or if you're eating healthy, we're still struggling with some of these other symptoms. So maybe we need to look closer into, specifically for you, in your body, in your genetic makeup, in your history of things that have happened to you. Most of us have a leaky gut, which has accrued over time. How do you need to support your system the best? And the challenging thing is, it's not easy for everyone to reduce inflammation effectively. But there are little things that we can do to reduce inflammation. Another big piece that needs to be addressed even more is supporting the liver and detoxification on a regular basis. And so much of this work is education for our patients. It's teaching them awareness in their bodies. When they eat something, how does their body respond to it? And unfortunately, when we are in a state of inflammation, most of us don't even realize that there are foods that are contributing to our symptoms until we significantly reduce inflammation, take a break, hit the reset button, and then systematically bring things back into our body. Because who wants to give up things like spaghetti and lasagna and cheesecake? Who wants to give those things up, right? Our bodies are primed, our brains are primed to want those things, right? Those carbohydrates, those starches, and those yummy fats and sugars, right? We're primed for that. So until you realize that these certain foods make you feel like garbage or make your skin break out or do other things, it's really hard for you to make some changes. So it is so important to teach our patients awareness on how their bodies feel. Teach our patients how their bodies work and how they're made, and how most of our society does not support our biology, and what are the things we need to do to focus on. Again, for some people, it can be too much. which unfortunately, if we would have learned those skills at an earlier stage in our lives, maybe we wouldn't have tipped into this point of disease, because it can be overwhelming to do all of these things, especially when you haven't done these for a long period of time. But I think with regard to my friend, she was very frustrated in the fact of, well, here's this chronic disease you have, just take a supplement. It's not that easy. And even when you look online and you're scrolling through Facebook, I get frustrated because, all right, eat blueberries to reduce dementia. Wish it was that easy. It's not that simple. And yes, it's important to eat blueberries because we need those phytonutrients, we need those antioxidants, but it's one little piece of a whole person and the things that this person needs to do to take care of themselves. And in my practice, as I started off working with chronic pain, people with pain issues and degeneration, it's worked into patients with even more complicated issues, because they come to the table and not only do they have knee pain, but there's also GI issues and high blood pressure and all of these other comorbidities that are all signaling, hey, we've got other issues that are deeper. There's inflammatory issues, we've got some gut issues, there's other things, and that gets in the way of what we're trying to do in the clinic. So as we identify what are the most important areas that patients need to explore is, yes, that concept of inflammation. Inflammation comes in so many different forms. It's the foods that we eat, it's toxins we're exposed to, it's the inability for our bodies to process toxins well. It's stress that can contribute to inflammation. So all of these things need to be considered and addressed with our patients, and we need to start teaching them how, what are little steps they can take. And habits have started over years, 40, 50, 60 years for some of us. So things don't change overnight, but how each day can we make little changes to decrease our inflammation? What little changes can we do to support the health of our cells nutritionally, and on those deeper levels? So as you learn more about functional medicine, as you learn more about the integrative approaches that we do, stay curious and ask questions. And if it seems too simple, it probably is. And maybe that helps you for a short term, but to get to that deeper level of healing and your body in a healthy place, you've got to address some of the bigger pictures and meet your patient where they're at.